My name's Dr. Karen Jones. I'm a GP at Binscombe Medical Centre in Farncombe, but I'm also a Macmillan GP working with Guildford and Waverley CCG, trying to improve the care of patients with cancer, try and pick cancer up earlier. The first thing I would say actually is when I ask women whether they're examining their own breasts, quite often they say, oh, I don't do it because I don't really know what to do. Well, actually, please don't get hung up about this. It's really important. I'll show you a method, but actually if you think, oh gosh, that's really confusing, just feel them. That's the most important thing, because if you know what your breasts feel like, then you'll be aware of any changes, and that's what's important. So just a very simple way of examining your breast. So the first thing to do is actually just look at yourself, all right? So stand in front of a mirror, put your arms up in the air, and what you're looking for is to see if there's any change. So you're looking to see if there's any inversion of the nipple, so the nipple going inwards. You're looking to see if there's any obvious lumps, if there's any puckering, so where the skin sort of looks as if it's being pulled in, where there's any dimpling, things like that. Okay, so have a jolly good look. The other thing to do is look at the nipple, see if there's any a rash, a bit like eczema, that just doesn't settle down. If you have eczema and you've got a bit of a rash, you might use your normal creams, but actually if it keeps coming back or it doesn't settle down, go and see your GP about it, because that can be a very rare form of breast cancer. The other thing you're looking at is for nipple discharge. So once again, if there's any blood or any discharge at all, and clearly you're not breastfeeding, then you need to go and see your GP. And the important thing to remember about this is usually if there's something going on, it's just on one side. It would be very unusual to have breast cancer in exactly the same place in both breasts. So you're going to put your arms up in the air and you're going to look at your breasts, okay? Just have a really good look, and then you're going to put your hands on your hips and press, and that tightens up the muscles here, and it might just show something else. It might just change the shape of the breast and show something up. Yeah. Okay, so when you've had a jolly good look and you've got to know what your breasts look like, and we're all a bit asymmetrical. I know my left side's a bit bigger than my right, so I just know that and I'm used to that. Yeah. So that doesn't faze me. Have a jolly good look, and then you're going to have a feel. So in terms of feeling your breast, people do it in different ways and at different times, and I actually find it easier to feel my breasts when I'm lying in bed. But you can do it in the shower, and that might be easier because then you'll remember to do it. Yep. In terms of time, if your breasts are very swollen and tender because you're due a period, just don't do it then. They'll feel sore and they'll feel a bit lumpy. Wait a week after your period. And if you're going to feel your breasts, monthly, which you don't have to do, but if you want to, then after a period is probably the best time to do it, with a nice and quiet. So if you're going to do it in the shower, put your arm up in the air so you're feeling your left breast with your right hand, okay? And that just flattens the breast out a bit. I'm lucky because mine are quite small, so it's easy to feel. And just start. So I start at 12 o'clock up here.
At the top.
At the top. Remember, if you've got big breasts, they extend right up the chest wall, so they can right up here. So you need to start there. And you're feeling with the three finger
fingers,
yeah. And you're just coming down and you're feeling all the way down, all right? Feel around the nipple as well, and then you just do it methodically all the way round. And if you know you've started there, you have to work all the way round the breast, okay? And remember to come right up here, the breast tissue extends
right under the arm.
Yeah, and you also got to do right under the arm. So come all the way round, just feeling, and it's quite firm pressure, especially if you've got large breasts. Actually, you have to feel quite hard to feel that deeper breast tissue all the way around. Remember to come in here, come across, all the way around. Feeling the armpit's important because sometimes breast cancer presents as a lump in the armpit. And if you feel with your arm up like this, then the tissues, your armpit's stretched out. So sometimes it's easier actually to put your arm down and
you're feeling for lumps, are you?
You're feeling for lumps, but actually also you're feeling for change. And sometimes I see women who come and they say, oh, it just feels different on that side, it feels a bit thicker, and that's important. So any
change, get to the GP.
Absolutely.
Brilliant.
Absolutely.